Hey everyone, and welcome to the Deep Dive. As a global health epidemiologist, something I'm sure you think about a lot is the gap between research and what actually happens out in the field.
Oh, for sure, all the time. Sometimes it feels like we have all this amazing research, these incredible minds tackling global health.
Right. Exactly.
But then putting it all into practice, it's like, well,
It's like hitting a wall.
totally. And that's exactly what we're diving into today. We're going to be talking about Donald Schön.
Okay, Donald Schön.
Maybe not a name you're super familiar with, but
I'm not, no.
his work, it really gets to the heart of this whole research practice dilemma. He was really ahead of his time.
Okay, I'm definitely intrigued. So how did he explain this disconnect? Like, why is it so hard to turn research into action in global health?
Well, he had this great metaphor. He talked about two different landscapes, the high ground and the swamp.
Okay, high ground versus swamp. I like where this is going.
So the high ground, that's where those nice, neat research problems live. The ones that fit perfectly into those traditional research methods.
Right, like randomized controlled trials, all those stats.
Exactly. That world, that's where things feel comfortable, controlled.
Yeah, a lot of my work happens up on that high ground for sure.
But then there's the swamp. That's where the real action is.
Okay, so what's in the swamp?
The swamp, that's where things get messy. It's those real-world problems that, well, they just don't fit neatly into a research study.
I have a feeling I spend a lot of time in that swamp, even if I don't always realize it.
I bet you do. Think about it. How often do you come across research that just doesn't quite line up with what you're actually seeing out in the field?
Oh, all the time. Like, I'll read a study with these crystal clear conclusions, but then I'll be working in a community where things are just, well, more complicated. Cultural beliefs or just a lack of resources, even political instability.
Yeah. And that's the dilemma, isn't it?
Right, so we have this dilemma of rigor or relevance.
Exactly. Do we stay on that high ground where the research is nice and neat? Or do we jump into that swamp where the problems are urgent, but the solutions are way less obvious?
So is it an either-or situation? Like, do we have to choose?
Schön didn't think so. He really believed that we need both.
We need both, okay.
We need that rigorous research and that practical, in-the-trenches knowledge if we actually want to solve those tough global health challenges.
That makes a lot of sense. It's like when we're dealing with something like vaccine hesitancy.
Oh, perfect example.
We have the research on how effective and safe vaccines are, but then to actually get people to get vaccinated.
You have to understand their concerns, their context.
Exactly. You have to meet people where they are, and that's definitely more of a swamp situation.
Absolutely. And Schön, he called this navigating the swamp, knowing in action.
Okay, knowing in action, what does that mean?
It's not just about applying knowledge that you already have. It's about learning and adapting as you go.
So being flexible.
Exactly. And here's the thing. Schön believed that this disconnect between research and practice, it's not just a personal struggle.
Okay, so it's bigger than that.
Yeah, it's built into how we think about knowledge, like how we create it, how we validate it.
You're saying it's a systemic problem.
Exactly. He saw it as this separation between research universities and professional schools.
Those ivory towers, huh?
Right. And that separation, it impacts how we train people, how we fund research, even what we consider to be valid knowledge.
So it's like this divide between theory and practice. It's almost baked into the system.
And that's where things get really interesting. It's like we're facing this, well, an epistemological crisis.
An epistemological crisis. Now we're getting fancy.
It just means that how we create and validate knowledge isn't really keeping up with how complex these problems are.
Wow, that's a lot to unpack. So we've got this disconnect, this crisis even. What do we do about it?
Well, there are solutions, and Schön's work gives us some clues. But first, I think it's helpful to understand just how deeply this disconnect affects global health.
All right, let's do that. Let's dive deeper into the specific ways this plays out in our world.
Sounds good. Let's jump right in.
Okay, so we've talked about this disconnect, this gap between research and practice.
Right, and how it's not just a little communication issue, it's like a fundamental problem with how we even think about knowledge itself.
Exactly. But I think what I'm struggling with now is how does this actually play out in the real world?
That's the important part, right? It's easy to get lost in the theory, but this disconnect has some serious consequences.
Yeah, especially for those of us working in global health.
Absolutely. I mean, for you as an epidemiologist, it creates a few major challenges.
Okay, like what? What kind of challenges?
Well, first, and we touched on this already, there's that persistent knowledge practice gap.
Right, where research findings don't always translate easily into actual solutions?
Exactly. It's like having a detailed map of the stars, but then trying to use it to navigate through a dense forest.
Yeah, that's a great analogy. I mean, have you seen any specific examples of this gap in your work?
Oh, tons. I mean, think about the COVID-19 pandemic.
Oh, of course.
It really showed us how much we need both types of knowledge, the research, and the practical know-how, especially in a crisis that was constantly changing.
Yeah, labs were working so quickly to understand the virus and develop vaccines.
Right, but at the same time, healthcare workers on the front lines...
They were facing a whole different set of problems.
Exactly. They had to figure out how to implement all these new guidelines in places where resources were scarce.
Oh, absolutely.
How to address vaccine hesitancy, how to adapt public health messages to different cultures.
It sounds like there were these two separate worlds, the world of research and the world of practice.
Right, and they weren't always talking to each other.
So we're missing out on those crucial insights from the front lines, those practical lessons that people are learning every day.
It's like sending a probe to Mars, collecting all this amazing data.
But then never actually using that data to improve the next mission.
Exactly, and that leads us to another big challenge, the scale imperative.
Okay, the scale imperative. Tell me more.
So we have this massive shortage of healthcare workers globally.
Right, and it's only getting worse.
And the traditional ways of training and sharing knowledge, they just aren't enough anymore.
Like those workshops and formal courses.
Yeah, they can be slow, they're expensive.
And they don't always address the specific needs of different contexts.
It's like trying to teach everyone to swim by giving them the same set of instructions.
But what if they're in a pool or a lake or the ocean?
Exactly. One-size-fits-all solutions rarely work in global health.
Okay, I'm seeing that now. So what's the solution?
Well, that brings us to the third and maybe the most challenging issue, the complexity conundrum.
The complexity conundrum.
The problems we face in global health, they're so interconnected and constantly changing.
Like climate change.
Perfect example. Climate change affects everything.
Food security, migration, infectious diseases.
Exactly. It's all connected. It's like a giant spider web.
You pull on one strand and the whole thing shakes.
And those traditional linear ways of thinking about problems, they just don't work anymore.
Okay, I'm starting to get a little overwhelmed. These are some big challenges.
But it's not all bad news. Schön's work actually points us towards a potential solution. Networks.
And networks, you mean like professional organizations, research collaborations.
Those are important, but I'm thinking of something even more dynamic and powerful. Structured peer learning networks.
Okay, peer learning networks. Tell me more.
Imagine a platform where healthcare workers from all over the world can connect.
They can share their experiences, learn from each other's successes and failures.
Exactly. It's about tapping into that collective wisdom of people who are actually out there on the front lines, facing these challenges every day.
It's like creating a global brain trust for global health. I love that idea.
Right. And these networks, they help us validate that practical knowledge, that swamp knowledge, and they allow us to share solutions that have actually worked in specific contexts.
So we're moving away from those top-down models of knowledge.
Exactly. It's about recognizing that everyone has something valuable to contribute.
Okay, this is all starting to make a lot of sense. I'm really interested to hear how these peer learning networks actually work in practice.
Let's get into that.
All right, so we've covered a lot of ground here. We talked about those challenges of bridging the research-practice gap.
Yeah, that disconnect between the high ground and the swamp.
Right, and then we got into those peer learning networks as a potential solution, which is really exciting.
Yeah, they hold a lot of promise.
But I think for me, I'm always looking for those actionable takeaways, like, okay, I get it, but what can I actually do differently, especially based on Schön's ideas?
It's not enough to just talk about the problem, right? We have to actually change how we approach things.
Absolutely. So what are those concrete principles?
Well, Schön's work gives us a few key principles we can use in our daily work.
All right, lay them on me.
The first one, and it might seem obvious, is to truly value multiple forms of knowledge.
Okay, multiple forms of knowledge.
We need to recognize that our expertise, your expertise as an epidemiologist, it's essential, but it's not the only valid way of knowing.
Right, it's not the only way.
People working on the front lines, those community health workers.
The people actually experiencing those health issues.
Exactly. They have so much experience and insight.
Yeah, it's like data can tell you part of the story, but not the whole story.
Exactly. You might have the numbers on disease prevalence.
But someone working in the community might understand why people aren't seeking treatment.
Right, or what cultural barriers are preventing them from getting the care they need.
I'm seeing that now.
Yeah.
So principle number one is to really seek out those different perspectives.
Yeah, actively listen to the people with that swamp knowledge.
Makes sense. Okay, what's next?
Principle number 2 is to enable knowledge creation from practice.
Okay, knowledge creation from practice.
Don't just think of frontline workers as people who receive information.
They're also producing knowledge.
Exactly.
Yeah.
Encourage them to share their experiences, what's working, what's not.
So that could be things like supporting community health workers to publish case studies.
Yes.
Creating platforms for them to share their stories, even involving them in the research process.
You got it. And that leads right into principle number 3, scaling through networked learning.
Okay, we talked about those peer networks, but it sounds like it's even bigger than that.
Think about how you share your own work, how you connect with others in your field.
So participating in online communities, contributing to those peer networks.
Yeah, and maybe even finding mentors or collaborators from different backgrounds.
People with different perspectives.
Exactly. And that brings us to our final principle, principle number 4, embrace complexity.
Embrace complexity.
Remember that spider web analogy we talked about?
Yeah, where everything's connected.
Global health challenges are rarely simple.
You can't just draw a straight line from problem to solution.
Right. It's about accepting that things are messy, they're unpredictable, and they're always changing.
So instead of getting overwhelmed, we need to develop the skills to navigate that complexity.
Exactly. So that means cultivating systems thinking,
Understanding how different factors interact with each other.
learning to adapt your approach as you go, and maybe most importantly,
Being okay with not having all the answers right away.
right. I think what I'm realizing is these principles aren't just about improving my work as an epidemiologist.
It's a whole new way of thinking.
That's what's so powerful about Schön's work. It's not just a set of tools or techniques.
It's a completely different way of looking at knowledge and action.
It's a call to action to bridge that gap between the high ground and the swamp.
To bring research and practice together.
Exactly. This has been a really great conversation.
It's definitely been eye-opening for me. I think I'll be coming back to these principles a lot as I continue to work in global health.
And remember, you don't have to figure this out alone.
There's a whole community out there.
By connecting with others and putting these principles into action,
We can create a better global health system.
a system that's more responsive, more effective, and ultimately more equitable.
That's a vision I can definitely get behind. Thanks for taking this deep dive with us. Until next time, everyone, keep learning, keep connecting, and keep questioning those assumptions.
Thank you for listening to this AI-generated deep dive. We welcome your comments and thoughts. To read the full original article, visit Reda Sadki's blog, redasadki.me. To learn more about the Geneva Learning Foundation's work, find us on social media. Don't forget to like, follow, share, and subscribe.